Hello and welcome to the Integrated Rehab and Performance Podcast. My name is Dr. Nick Curtis and I'm running the show here at the Integrated Rehab and Performance Center. Today we are talking about proprioception. Specifically, last golf episode we talked about the single leg balance test and a little bit about how proprioception is a major player in that. But I want to go in more details about some of the background behind proprioception, why it's so important, and then we're going to go way beyond golf even in this episode to discuss how proprioception is impacting things like muscle hypertonicity, right? So tight muscles, painful muscles, and even joint pain and things like that, right? So it's important for the golfers out there in terms of training it and kind of taking proprioception into account when it comes to pain and range of motion, but also anyone else there, any exerciser or anyone who likes to stay fit, or people who use their body for their work, right? Proprioception is an important part of the rehab process as much as it is the performance side. So let's dive into that a little bit here today. Okay, so first thing that we need to discuss when we are starting to talk about proprioception is joint neurology and joint innervation, right? So let's just first of all discuss what proprioception is and how it works in physiological and anatomical terms. So we are talking about sensory perception of joints when we are talking about proprioception. Okay, we need to know, or the brain needs to know, where the joint is in space relative to other joints and how fast it is moving, whether or not it's moving, and how much force it is taking or accepting. Right? All of these things will tell the brain what's happening and what to expect, really, which is kind of the more important part. Joint proprioception actually precedes movement, right? The brain perceives the joint proprioception, the information coming from the joint, before it decides how to move or where to move. There is a direct line from the joints, the proprioception from the joints to the brain that bypasses the spinal cord. There are only three tracks in the body that do this. One is proprioception, two is vision, and three is the vestibular system, which again, coming from our, you could say our ears, right, helping with balance, right? So another kind of proprioceptive understanding where we are in space type system, right? All three of those things. So you can see how important this understanding of where we are in space is to the body, right? And motion. It precedes motion. It's super important. So when we have issues at the joint level where the brain is not receiving information, things happen, right? We just discussed how important the brain, how important proprioception is to the brain, that we can understand if we stop getting proper signaling to the brain from joints, then the brain's going to do something about that, or at least going to try to, and there's going to be adaptations that occur in the body because it is such an important track, right? An important concept of proprioception. So a lot of times, things happen at the joint level when we stop receiving good proprioception. Well, first of all, how does that happen? How do we stop receiving good signaling from the joint? Well, if we don't use that joint a lot. When we stop using it, we stop getting signals from the joint. That is a first stage of issues forming, right? Another thing is we lose range of motion to the total end range, or we just stop going to total end range of proprioception, right? So this looks like when we're seated all day or seated and our hips are in that flexed position, we don't spend a lot of time with our legs in complete extension, especially if we're not walking much and doing other things. Another example would be our head posture, our neck posture, where we are kind of rounded a little bit forward at our upper back, and our head is only tilted upward again to match the horizon from the small muscles in the back that attach the back of our head to our neck. So we lose a lot of work from the anterior or the front side deep muscles of the neck, as well as the back side extensors lower and then in the mid-neck. Right, so we have two groups of muscles that are really working hard, and the rest really aren't working. And the joints around that neck, the segments there, the vertebrae, they tend to be in similar positions all day long, and we lose access to that end range because we're first just not going there very often. And again, there are some adaptations that the body uses when this sort of thing happens. And one big adaptation is pain. So let's talk about joint innervation, because this will lead into the pain discussion a little bit. There are multiple different proprioceptive, you could say, neurological structures in each joint, right? So again, we're talking about perception at the joint level. You can think of every joint being encapsulated by different tissue and sensors, right? So what we need to know is that there's different types of sensors that will sense different things. An example could be if you, say, poke your, let's say, your wrist, and you just sustain that pressure for a long time, say 60 seconds, and then let go. There are certain receptors that will perceive that initial poke and then will go quiet for the next 58 seconds. It will not be stimulated, and then the moment that pressure is relieved, those receptors will be stimulated again, right? So rapid change in the environment, certain receptors will perceive that and signal it. Other receptors don't necessarily react to the rapid change, but more slow. They're slower to react, and they will react to that long-term pressure. So they will be giving signals to the brain for that 58 seconds in between the initial poke and then the release of the poke. You can think of this like when you put a hat on. When you initially put that hat on, you tend to feel it, right? You know you just put it on, you feel it on top of your head, and then you can go the next hour or more, and you won't even perceive that hat on top of your head, right? Unless something happens where, for whatever reason, the hat might be too tight, and every now and then you kind of recognize that it feels tight around your head, but you're able to forget that that hat is even on your head most often, and that's because there's certain receptors that will be stimulated when you initially put it on, and then they will go quiet until something changes. Okay, and that is just a few of the different joint neurology that is taking place at any given area. Again, that happens in the skin, just anywhere, but also, and we're more importantly talking about the joints here, right? Because that is where movement comes from. Now, what we also have in these joint perception is pain, right? We have nociceptive fibers that innervate these joints. When we stop getting sensation for rapid change and slow change in these joints, the brain wants to know what is happening at these joints. It's one of the most important things that the brain needs to be able to understand what is happening. Again, of course, there's lots of visceral things that the brain needs to track, like blood pressure, heart rate, sodium levels, carbon dioxide levels, things like that, of course. But we need to be able to move around in our environment. The brain needs to understand what's happening at the joints so that it can use them. When those receptors go quiet, pain ramps up, right? So the pain fibers start, when that joint fiber isn't being stimulated, those pain fibers start to stimulate that joint regardless. So then we start feeling pain and discomfort in certain joints, okay? So this is one of many different causes that people can have for pain that come into the office, right? And oftentimes, some of the treatment includes end range loading, where we're getting the proprioception back into these joints, right? This isn't just an ankle joint, right, or foot joint, or different things like that. We're talking about lumbar vertebrae, thoracic vertebrae, cervical vertebrae, hip joints, knee, wrist, shoulder. All these things need proprioception, and when they stop getting proprioception in certain ranges of motion, oftentimes pain can come just from that, even just from that. Without even having any damage done to the tissue, we can get pain. Right, so this is why this is kind of a conversation beyond just golf, and how important proprioception really is for the rehab side as well as the performance side, right? And now if we can improve proprioception through these areas, not only can we reduce the pain that's happening through there, but again, we can also improve performance. This could be obvious with things like balance, right? Where the brain can understand what's better happening at the ankle. The brain can better understand what's happening at the knee. And really important is the brain can better understand what's happening at the hip. A lot of people don't realize how much proprioception and balance comes from the hip joint. And we can test this. I had mentioned this last golf podcast where we can test this at the hip as well. We want to know everything happening at the foot, ankle, knee, and hip. And a lot of times people really struggle with balancing at the hip, right? We have a certain way of testing that. So again, lots of important little details here about the physiology and anatomy that occurs with proprioception. Now, with all that being said, I just want to go into a little bit more detail specifically about gamma motor tone and talk specifically about joint and muscle stiffness, right? So we feel stiff or tight. Here is a common cause for that, lack of proprioception, kind of something we had just mentioned. There's something called gamma motor tone or gamma motor neurons. What these things do is they sense the tension in a muscle, right? So if we are in a state where a joint is not getting adequate proprioceptive information, the gamma motor neurons that serve the muscles that go around that joint, right? Because that's kind of how bones and joints work, is the muscles that cross that joint will work on that joint. So if the proprioception coming from that joint is lacking, then the gamma motor neurons will create a state that shortens that muscle, right? It starts to reduce that range of motion happening through that muscle because the brain cannot confidently understand or tell that joint where to go because it's not getting the information back. It's not getting the information from the joint to the brain, from the joint to the brain, right? That's the important track here, is from the joint to the brain. That's the part that's missing. And what happens, those gamma motor neurons start to react, they start to adapt, they say, let's shorten this muscle around here. It's getting information from the brain saying, shorten up, protect that joint, because I can't, right? I don't understand exactly where it is. The neurons, the nociception from that joint start firing, starts creating pain, right? Trying to bring information back from that joint. It wants to create stimulus around that joint because it's been lacking it, okay? So there's kind of a 1-2 punch where we get pain around a joint and we get stiffness around that joint. And both things can directly come from lack of proprioception around that joint. Now, a few things that we do to work on this, especially on the rehab side. Well, a chiropractic adjustment is really good at creating and stimulating the proprioceptive fibers around that joint. We get a joint to end range, and then we give it one last, let's say, impulse into that end range. That does a fantastic job of creating an abundant amount of feedback from all those receptors that we talked about earlier, the slow ones and the fast ones. We have also other techniques that help us stimulate those slow reacting end range fibers so that the brain, again, can understand where it is in space. Beyond that, we use that to then start working on general range of motion activity, and then we can build the stability on top of that. And this gives the brain full control of that joint back when it was lacking it previously, right? So we create stimulus from that joint. We reduce pain that way. We can tell the gamma motor neurons that they can start to relax a little bit. We start to work on different mobility drills to, again, tell those gamma motor neurons and the receptors in those joints to be happy, tell the brain to be happy, and then we can use those muscles actively around that range of motion we just created so that the brain has a perfectly great understanding of what muscles control that joint and the access that they have to that range of motion, and to be comfortable, confident operating at those end ranges of motion, right? So we practice working at those end ranges of motion so that the person, the client, the patient can take that range of motion home with them. They can use it, reduce pain, improve performance. Okay, so we talked a lot of theory here today. We talked a lot of the anatomy, the physiology of proprioception, some of the different structures that are involved, how the brain is involved, how pain is involved, and again, how muscle stiffness and performance is all involved. I hope you guys enjoyed that and were able to take something from this. Again, kind of theoretical. We tried to dive into some of the details without getting too deep into the details and into the science. I just wanted to make sure that you guys can relate this to whether you're on the rehab side of things, dealing with pain and lacking range of motion, or you're on the performance side of things where there's not so much pain, but we still need to work on gaining access to range of motion and then owning that range of motion. Okay, so thanks for tuning in. We'll have another podcast going out next week. Thanks. Bye.